This program is about body mechanics and moving your patient. After completing this lesson, you will be able to describe 3 principles of good body mechanics, describe 2 principles of safety to apply when moving the patient, define the purpose of a gait belt, and explain the steps in repositioning your patient.
It is the end of another long day on the job, transferring patients, assisting them to turn and reposition, carrying linens and groceries. Some days it can be a great job, but tell me, how does your back feel? Does it feel like you've just finished a great day? Or does it feel like you've had a back-breaking job? Has a backache ever put a crimp in your after-work plans? Perhaps you've even lost hours at work because you've strained some muscles lifting a patient out of the bathtub. Backs can not only ache, but they can be a real pain. Approximately 8 out of every 10 people will experience back pain at some time in their lives. Every year, millions of Americans sustain back injuries as a result of improper lifting techniques. Here are some eye-opening facts and figures which show the significant socioeconomic impact of back pains and injuries. 80% of Americans will suffer from a back injury. 30% of all work-related injuries are back injuries. 5 million Americans are partially disabled by back problems. Another 2 million are so disabled that they cannot work. Back pain is the most expensive health problem in the 30 to 60-year age group. Work days lost due to back pain are second only to days lost from upper respiratory infections. Low back pain accounts for 93 million workdays lost every year and costs over $5 billion in health care. The cost in pain and suffering and in dollars spent and time lost is unacceptable and avoidable in the great majority of cases. These points underscore the critical importance of safeguarding your back. One of your goals as a healthcare worker is to maintain a healthy back and to take the measures necessary to prevent back injuries. A healthy back requires lifelong attention and good posture, proper exercise, and proper body mechanics. We'll look at each of these areas and then discuss how they apply to your work with patients. But first, we must learn a little about the back and why it's so prone to injury. Your backbone is designed to protect the spinal cord, support your entire body, and enables you to move about. It's made up of 24 marshmallow-shaped bones, stacked like donuts, with shock-absorbing cartilage discs sandwiched between. Wing-like spikes extend to the sides of each bone, and a spinous process juts backward. Ligaments, tendons, and muscles attach to these bony prominences, fastening everything together into a remarkable functioning framework. As you can see, the adult spine is shaped like a shallow S with 3 natural curves. The neck curve is 7 cervical vertebrae. 12 thoracic vertebrae curve outward, each attached to a pair of ribs to form the middle back curve. The 5 lumbar vertebrae form the low back curve, an area especially vulnerable to injury. The natural curves of your spine are very important to your health and performance, and they are also very prone to injury. Your spine needs support from flexible muscles and good posture so it does not go out of line and result in injury to you. The first step to a healthy back is good posture. Posture is the way the back lines up. Poor posture causes muscle tension, stiffness, back aches, neck aches, and a tired, dragged-out feeling. Good posture gives the back the support that it needs. We have good posture when the curves of our spine are in correct alignment. Imagine a plumb line next to your body. If your ears, shoulders, hips, knees, and ankles are aligned with the plumb line, the 3 curves are in correct position. Your body is balanced, and weight is distributed evenly throughout the vertebrae and discs. To achieve good posture and keep the 3 curves in alignment, you must stand tall with your head up, chest high, shoulders back, stomach muscles tight, and buttocks pulled in. Good posture can quickly become a natural and comfortable habit that promotes the health of the spine and helps us to look, feel, and function best. Good posture involves practicing 3 healthy behaviors. Achieve and maintain a healthful weight. Extra weight can pull your posture out of line. Try to control the stress in your life. Stress and worry can cause your back muscles to tense up and trigger back injuries. And do some regular exercise. Walking, jogging, swimming, and bike riding can stretch and strengthen the muscles that support your back and improve your posture. The right kind of exercise done properly and regularly will strengthen the muscles which help hold body parts in good alignment. Exercise can reduce vulnerability to injury and disease and help us to resist the power of gravity which causes legs to bow, backs to sway, and shoulders to stoop. Some simple exercises can condition and strengthen your back and will contribute to good posture. To determine the exercise program best suited for your needs, you should consult with your physician or physical therapist. And when you exercise, be sure to wear proper attire and do a few conditioning exercises as a warm-up. Here are some simple exercises to include in your program. Neck stretches increase the flexibility of your neck and shoulder muscles, minimizing the possibility of strains. Bend your head to the left with your left ear over your left shoulder. Hold for 10 counts. Repeat on the right side. Drop your head forward on your chest, then slowly swivel it to the right and to the left. Repeat each movement 5 times. Half sit-ups strengthen the abdomen and reduce sway back. Lie flat on your back, knees bent, and feet flat on the floor. Cross your arms over your chest. Slowly raise your head, chest, and shoulders about 2 to 3 inches off the floor. Hold for a count of 5. Slowly return to the starting position and repeat 5 times. The hamstring stretch limber hamstring muscles and lower back muscles. Lie on the floor with both knees bent. Slowly extend one leg up until you feel a slight stretch and hold it for a count of 10. Repeat 5 times and then do the other leg. The last area we will talk about for a healthy back is body mechanics. Like the supporting framework of a building, there is a correct relationship of all parts of your skeleton. Unlike the framework of a building, our bodies are dynamic. Parts constantly change both position and relationship as we stand, sit, and move. Body mechanics involves the way we bend and twist, lift and stretch, move about, and use our body. It is the way parts of the body move and work together. Good body mechanics means moving the body in an effective and careful manner. It involves good posture, alignment, and balance, and uses the muscles in the legs and upper arms, the body's strongest muscles, instead of the ones in the back. When we distribute weight and workload safely and efficiently, we are practicing both good posture and good body mechanics. Practicing good body mechanics can provide safety and comfort for the patient, maintain proper body alignment for you and the patient, and prevent muscle strain, fatigue, and injury during the performance of patient care procedures. The body's center of gravity plays a key role in body mechanics. Understanding this concept can help you maintain your balance and protect you from injury when you assist patients. The center of gravity of the body is in the pelvis, just in front of the sacrum. Your feet provide the base of support. The relationship between the center of gravity in the pelvic area and the base of support determines how stable you are. As long as you do not move, the triangle is stable. However, when you move, you change the relationship between the center of gravity and the base of support. The body becomes unbalanced, and you can lose stability. To keep your balance, remember these principles. When you widen the base of support, you increase stability. So move your feet apart when working with patients. You can also improve stability by lowering the center of gravity. So kneel or squat instead of bending over to pick something up off the floor. So let's review the principles of posture and center of gravity, which you can apply both to your life and work. Stand erect. Good posture is essential. Always have a broad base of support. Keep your feet 12 inches apart. Kneel or squat instead of bending over at the waist. Let's watch our model as she demonstrates important principles applied to standing, sitting, and lying in bed. Many people find that standing is very tiring, particularly if you stand as our model does. Bending and leaning over your work area can cause fatigue, aches, and cramp-like pain. You don't need a plumb line to see that the spinal curves are out of alignment. To minimize strain and fatigue and keep your blood circulating when you are standing for long periods of time, adjust the height of your working surface to waist level if possible to promote good posture. Keep your feet about 12 inches apart, 1 foot slightly forward. For longer periods of standing, alternately rest 1 foot on a shelf or stool. Do foot exercises at intervals. Step in place, wiggle your toes. Shift your weight from 1 foot to the other frequently. Walk around every hour. Even though standing can be tiring, sitting is actually more stressful to the back. Chairs you sink into and can hardly get up out of may feel comfortable, but they strain the lower back, stretch ligaments, and may put pressure on spinal nerves. Our model is leaning away from the desk, holding her head in a rotated position, all unnatural positions which can cause neck and back strain. When you are sitting, the chair should provide firm support for your back and support for your thighs. Your buttocks should be against the back of the chair. You can use a small pillow to support the low back curve. Armrests help you get up and down using arm and shoulder muscles, rather than putting the strain on your back. Your knees should be level with your hips, your feet flat on the floor. A healthy backbone can withstand thousands of pounds of pressure, but lifting even light objects improperly can put a great strain on the muscles and bones and can cause injury. As our model bends over to pick up this full basket of laundry, her back becomes a fulcrum, supporting the weight of the body and the load. It's almost too painful to watch. When you are faced with a lifting challenge, consider other options. Can you push or pull the object? Can you put it into a wheeled cart? There are times when you must lift an object. In that case, size up the load. If it's heavier than you can handle, or if you have to lift it higher than the waist, get help. And remember these principles when lifting. Stand close to the object with your feet apart. A wide base of support helps maintain balance. Bend at your knees and hips, not at the waist. Tighten your stomach muscles as you lift. They support your spine, offsetting the weight of the load. Hold the object close to you to distribute weight to your entire body instead of just your hands and arms. If another person is helping you lift, discuss your strategy first to coordinate your efforts. Synchronize your efforts and balance the load. Now we'll watch our model as she lifts the basket using these principles. With her back straight, stomach muscles tight, and a wide base of support, she lifts with the powerful leg and shoulder muscles, not the back muscles. She keeps the object close to her. Through safe lifting techniques, you will minimize the possibility of serious injury to your spine. And let's not forget about bedtime. Sleep is a perfect way to rest your back because it doesn't have to support the weight of your body. However, if you sleep in a chair, lie on a sofa with your head on an armrest, or propped high on too many pillows, you will wake up tired and sore. See how our model's body is out of alignment. A good position for sleep is on your back with your knees slightly bent. A small pillow under your neck supports the head and keeps it level. Use a small pillow to support your knees. Another good position is on your side with your knees slightly bent. A firm mattress or a bedboard under a sagging mattress is essential to support the spine and aid good posture. If you wake up in the morning with a backache, it's probably time for a new mattress. Time for a short review of the important points we've learned. What is one way to determine if you have good posture? What is one principle of good body mechanics to apply when you're standing? Sitting. Lifting. How is the center of gravity related to stability and balance? How can you improve your balance as you move? Now it's time to put the principles of good posture and body mechanics to work. We don't want you caught in a back-breaking job. We'll meet Tom and his caregiver, Judy. Tom, 6 foot 2 inches tall, has had arthritis for several years. Tom's ability to move varies from day to day, depending on the degree of stiffness, rigidity, and pain he experiences. Tom is a good model for our demonstration. His caregivers have done an excellent job of educating him about body mechanics and the goals of his treatment. He knows that the more active he is, within the limits of what is safe and well tolerated, the more he'll be able to do. Tom also regularly follows a home therapy program, which helps him maintain flexibility and strength, making it easier for his caregivers to work with him. Judy will show you how to make patient care a safe, satisfying experience, speaking from the perspective of your spine, when you move and lift your patients. Here are some important general rules that Judy and Tom will be showing you. Remember them as you help your patients move about. Use the care plan as your basis of care planning and delivery. Follow directions for activity, mobility, and positioning that are noted on the care plan. Know what your patient can and cannot do. Plan your actions before you begin and include your patient. Tell your patient what you'll do and what he or she should do before you begin. Explain procedures as you're doing them. To synchronize your actions, count 1, 2, and 3, with the patient moving on the third count. That way, you'll work as a team. Assist and encourage patients to be as active and independent as they are able. Keep your patients comfortable and covered. Respect their privacy. Put safety first. Your patient should wear sturdy, low-heeled shoes with non-slip soles. Never leave an unsteady or weak patient sitting or standing alone at the side of the bed. Try to remove all loose throw rugs or obstacles. Clean up slippery floors or water spills on the floor. Good lighting is also essential. Remember good body mechanics and prevent muscle strain, fatigue, and injury to yourself and the patient. Keep a wide base of support. Bend at the knees. Use the stronger muscles of the shoulder, upper arms, and thighs to do the work, instead of the back muscles. Tighten your stomach muscles before lifting or moving your patient. Stay close to the patient. You'll provide support and help prevent falls for the patient and minimize strain on your back. If the height of your patient's bed is adjustable, lower the bed before transferring the patient. This will prevent accidents. Elevate the bed before changing the linens or bathing the patient in bed. This will help you maintain proper alignment of your spine. Most importantly, think through the procedure and plan how you'll use your body mechanics before caring for your patient. And some other points. Wash your hands before and during care delivery as necessary. Monitor your patient's condition. Some patients may experience some lightheadedness or dizziness when they first stand up, as the body adjusts to a new position. This is especially true if your patient has low blood pressure, circulatory problems, or is on certain medications. Encourage your patient to take a few slow, deep breaths before moving. If the dizziness lasts longer than a few minutes, help your patient to lie back down. Note the pulse and respirations and record your patient's response. If the vital signs vary from the patient's normal readings, if dizziness persists, or if fainting, difficult breathing, or other symptoms of distress occur, notify your supervisor. Otherwise, let your patient rest for a short while and try again, remaining alert for problems. Document care delivery and appropriate observations. If you encounter any difficulties or your patient or family requests that you move the patient in an unsafe way, contact your nursing supervisor. It's time for Tom to return to bed for a short rest before his bath and exercises. Judy has explained to Tom how she'll help him get out of the chair and walk to bed. You'll notice that Tom wears a gait belt, also called a transfer belt. A gait belt is helpful for the patient who needs assistance with transfers and ambulation. The belt goes around the patient's waist, enabling you to maintain a firm grasp of the patient when transferring or ambulating. You can obtain a gait belt from a medical equipment dealer. If your patient doesn't have a gait belt, use a wide, strong leather belt. When using the belt, be sure that it fits snugly, but not so tight that it causes discomfort and breathing difficulty. Don't apply the belt over bare skin. Be careful that a woman's breasts are not caught under the belt. Now let's watch the transfer. The patient slides his body forward by bracing himself on the armrest. Grab both sides of the patient's gait belt and give the patient a gentle boost using good body mechanics. At the same time, the patient pushes on the arms of the chair to assist. Give the patient a few seconds to gain his balance. Then slowly walk toward the bed. If your patient is unsteady or has one-sided weakness, walk on that side, slightly behind the patient. Position one hand on the patient's outer hip and your other hand on his arm or at the elbow. You are now in a position to assist the patient to maintain stability or to ease him to the floor if necessary. Be alert to prevent any falls. If your patient has good balance and does not use an assistive device, walk on his strong side. When you reach the bed, assist the patient to turn and stand with the back of his legs against the edge of the bed and gently ease him down. Remove his shoes. With one hand behind the shoulders and the other under the knees, rotate the patient into bed, gently easing him down. Like Tom, your patient will appreciate the extra assistance you provide to get him settled into a comfortable position. Many of your patients may spend greater amounts of time in bed, so comfort and positioning are important. Pillows, pads, sandbags, and other items may be necessary to provide support and comfort and to prevent edema, circulation problems, pressure areas, contractures, and deformity. A stroke patient will need support to prevent foot drop, for example. A small towel roll will keep a paralyzed hand in an open position. If your patient has a cardiac problem or perhaps has difficulty breathing, the care plan may call for a semi-sitting or Fowler's position. Other patients may need this position for drinking fluids or taking a snack. If your patient has an adjustable bed, raise the head of the bed 45 to 60 degrees. For patients with a flat bed, you'll need 3 pillows. Judy and Tom will show us how to use pillows for positioning. Arrange 2 pillows on the bed ahead of time so you can slide them into place easily with one hand. Lift the patient by locking arms. To do this, face the head of the bed and slide one arm under the patient's shoulder, bringing it around so your hand is on his other shoulder. The patient places his hand in the same position. Carefully lift the patient, supporting his neck with your other hand. Slide the head pillow up, reach over and place pillow number 1 at an angle on the far side. Crisscross it with pillow number 2, and place pillow number 3 across them. Gently ease the patient down onto the pillows. Repositioning your patient is a very important part of care delivery. When turning and repositioning your patient, remember the principles we've learned. If your patient is difficult to move, sometimes a family member may help if one is available. If a family member assists, he or she must also practice good body mechanics. Be sure to set a good example. If you're working alone, always turn the patient towards you to remove the danger of the patient falling out of bed. The bed should have side rails. If it doesn't, position a chair on the opposite side from where you're working. When caring for a patient in a double or queen-size bed, Assist the patient to move to one side of the bed so you don't have to reach across. All beds should be locked or otherwise secured in place so there's no danger that they will move during transfers. Today, Tom is more stiff and needs some help with turning. The process of repositioning is done in two parts. First, move the patient to one side of the bed, which gives room for turning and positioning on his side. Then, assist the patient to turn. Again, explain your actions and use good body mechanics. In the next segment, watch how Judy shifts her weight from foot to foot with knees bent and a wide base of support rather than bending over at the waist as she moves the patient toward her. She also turns her entire body to get the pillows rather than twist at the waist. Here is the procedure to use. Remove pillows and blankets that restrict movement, but keep the patient covered. Place one arm under the patient's neck, grasping the shoulder, and place the other arm under the middle of the back. Move the patient's upper body towards you. Place your arms under the waist and thighs and move the patient's buttocks towards you. Then, place your arms under the thighs and calves to move the legs and feet. Now your patient is in a position to be turned onto his side. Raise the side rail and go to the other side of the bed. Grab the pillows and remove the sheet. Cross the patient's ankles so the top foot faces the direction of the turn and flex his knees. With the patient's arms over his chest, place one hand firmly around the shoulder, the other hand behind the hip, and roll the patient gently towards you. Prop one pillow against the back and put one in front of the bottom leg with the other leg flexed on top of the pillow. The patient may need a small pillow to support the arm and hand. Replace the bed covers and check with your patient to make sure he's comfortable. Then raise the side rail. We'll let Tom rest so we can talk about activity and exercise. In your training, you've learned that it's important for your patients to move about and change positions frequently. Activity and mobility can mean many positives for your patients. Consider these benefits: improved circulation with decreased risk of blood clots and atherosclerosis, stronger heart muscles, less risk of cardiovascular disease, increased lung capacity, reduced shortness of breath on exertion, less chance of pneumonia, lower blood pressure, improved appetite and digestion, less constipation, and healthier muscles and bones. Many of your patients may not be able to participate in a regular exercise program. However, even the smallest bit of exercise is beneficial, not just to keep them on their feet and at least somewhat independent, but to keep them mentally alert and feeling good about themselves. Do everything possible to keep your patient as active as they can be. Many patients will be on a physical therapy program. This is a program of exercises developed by a physical therapist to help the patient maintain strength, flexibility, joint motion, and maximum physical functioning. The therapist customizes the program to the skills, abilities, and needs of the patient. You play a very important role in assisting a patient with an exercise program. Be sure that you understand the instructions and exercises and know how to assist the patient. Understand what activity is allowed and restricted, your patient's limitations, and any precautions. If you have any questions, contact your supervisor. Follow the program instructions precisely as to the type of exercises, number of repetitions, weight bearing, amount and type of ambulation, use of assistive devices, etc. Don't modify the program without receiving specific directions from your supervisor or therapist. Document the patient's performance of the exercises, noting tolerance and any important observations. Report significant findings to the nurse. For some of your patients, you may be assigned to use heat or cold treatments to relieve pain, stiffness, or swelling. Be sure that you follow proper procedure. Observe, document, and report accordingly. And work with your patients to modify the environment so it is safe and functional to accommodate the patient's disabilities, maintain safety, and promote the optimal level of functioning. Time for some more questions. What is the purpose of a gait belt? What are two principles of safety to apply when assisting a patient to ambulate? Can you describe the steps in repositioning the patient? And what is your role in assisting the patient with an exercise program? We have covered many important points that are essential to the comfort and safety of you and your patients. Study and apply these principles. Discuss any concerns with your instructor. We'll see you again for the second part of this program. You'll learn more about moving and transferring your patients, including use of equipment. Until then, take care of your back.